Hello, I'm Michael Good, CEO of University of Utah Health, presenting the COVID-19 update for July 20th, 2021. And we continue to see a increase in cases of coronavirus at the national and state level. It is certainly a consistent increase, not the sharp rise that we saw at earlier parts of the pandemic, but nonetheless, a worrisome continual increase, both in the United States and here at the University of Utah and our state of Utah. So here is the national chart, and you see back here in the mid-June period, we started to see what has now become a pretty good upslope in the number of new coronavirus cases reported each day in the country. So far, the number of deaths have not increased dramatically. Remember, there are approximately 2 to 3 week delays between when changes in case rate translate into changes in hospitalization rate and then on to deaths. So we do worry that these increased cases will result in increased deaths at the national level. And a similar pattern here in the state of Utah, where again, maybe a little bit earlier toward the beginning of June, we started to see this increase in cases, which on a 7-day moving average now approaching 600 cases a day with an increasing slope, continuing to go up. Fortunately, we haven't seen too much. There is a lot of day-to-day variation in the number of deaths reported, but when averaged out, kind of running between 1 and 2 deaths a day here in the state of Utah from coronavirus. So that means our active infections are increasing. We had gotten to a point here again toward the beginning to middle of last month where we were 1 in 600 individuals that had a coronavirus infection. And now with this increase in new cases, we see this slow and steady increase to where now 1 in 300 individuals has an active infection. The national level, we've seen this same curve start to take a upward trend as well. No surprise, the reproductive number, which describes how many individuals, each person with coronavirus spreads the virus to other people. And we now have the better part of a month and a half where the reproductive number's been above 1. You can see it shown also up here in the inset, but a reproductive number above 1 meaning each person spreads the virus to more than one person, and so our numbers continue to grow. Certainly not at the level that we saw back here at earlier parts of the pandemic or even the beginning of the pandemic, but a sustained period of time above 1. And so that is why we've had this consistent upsloping curve in the number of new coronavirus cases. More cases over the last month or so means more hospitalizations. And we did see that pretty dramatically here, again, about the middle of the month, where the number of hospitalizations in the state of Utah had been pretty steady in this range here of around 130 or so, and now dramatically increased to where we got to a point where we had around 250 to 260 Utahns in the hospital each day with coronavirus. Came back a little bit, but in more recent days, as you can see, returning to an upstroke or an upslope. So we'll want to keep an eye on that. The hospitals in Utah are quite full right now. Obviously, a part of that is coronavirus patients, but also just the healthcare system broadly in our state is very busy this summer. And so this adds stress to already full hospitals. Another stressor that you see here on the red curve, which is the number of Utahns that, of those that are in a hospital, how many are in ICU beds. And you can see that had gotten down near 50 or so, and now is back up at 100, a little bit over 100. So the patients that are in the hospital are sicker. The COVID patients that are in the hospital, more of them are in ICUs. And that is the nature of this Delta variant. It spreads more easily, particularly among the unvaccinated, or essentially among the unvaccinated. I'll show you some more charts on that in just a second. But it also provokes a more severe form of COVID-19. And so we see actually here even, the little bit of variation up and down, but a continued increase in the percentage of patients that are in intensive care units with COVID-19. Positivity rate, really worrisome of those getting coronavirus tests, whether that's done by the test over test method or the people over people method. Both of those, as you can see, right around the start of the month of June, really took off, and now are getting back up to some, the people over people method, meaning are approaching 15%. That means one out of 6 individuals tested for coronavirus is testing positive. Or if you take all the tests, whether they're repeat tests or first-time tests, all the tests collectively, 1 in 10 is positive. We had gotten down to where, 3 or 4 out of 100 were positive. We're now up to 1 in 10, or 10 out of 100 being positive. So this Delta variant of the coronavirus, again, just to repeat, spreads particularly easily among unvaccinated individuals. And so we're seeing more and more positive tests, more and more individuals with COVID-19. So like many of the other charts, our admissions into University Hospital, you can see, again, a little bit of up and down variation. But for a period of time now, we've been seeing more and more individuals admitted to our hospital after a period here, pretty sustained period of having around 15 or so coronavirus patients. You can see we've now pushed right through 20 up to 25 and are really approaching 30. Today we actually had 30 coronavirus patients, COVID-19 patients in our hospital. So far at the University of Utah Hospital, after having about equal numbers of patients in the ICU and on the medical ward, our patients have been more on the medical ward than in the ICU. So a little bit different than the statewide trend. But again, we've seen periods throughout this pandemic where there'll be fluctuations one way or the other. But nonetheless, we've gone from 10 to 15 to 20 to 25. And as I said, today we hit 30 coronavirus patients. So this increasing cases is turning into increasing hospitalizations. So far, we haven't seen an increase in the overall death rate, but we certainly would not be surprised if that were to happen in the future. I really want to stress that this virus is moving around principally in unvaccinated individuals. And so the importance of getting a coronavirus vaccine cannot be emphasized strongly enough. Here you see the charts that we update. We do continue to make progress in the 12 to 18-year-old group, if you will, the last group which had approval for the vaccine, kind of leveled off at a very high level among 70 to 80-year-olds, 80-year-olds, 60 to 70-year-olds. This is really important because these were the individuals at the beginning of the pandemic that were most susceptible to getting the severe forms of COVID-19. and many dying from it. But now, as we've seen, the disease is moving into these lower age groups, particularly among the unvaccinated. And so we really need to continue the push to vaccinate everyone who's eligible for a vaccine. This slide is perhaps the most important in our update today. It shows the number of coronavirus cases per 100,000 population, and it's broken down into individuals who are unvaccinated or fully vaccinated. And you can see this tremendous difference in new coronavirus cases between the unvaccinated and the fully vaccinated. So fully vaccinated, we're talking about 5 individuals out of 100,000 contracting a new case of COVID-19, 5 out of 100,000. In contrast, we see 5 times that in the unvaccinated group, or just under 25 per 100,000. So a 500% increase in the number of individuals contracting coronavirus if they're unvaccinated as compared to those that are vaccinated. Also notice the rate of incline, or the rate of increase here among unvaccinated individuals starting back here in early June, and compare that to kind of the slow upward drift of the fully vaccinated. So there are a few individuals fully vaccinated that are coming down with coronavirus, but the vast majority are in the unvaccinated, which is why we're going to just continue to stress the importance of talking with family members and friends and individuals in your community about why getting vaccinated is so important. It is the unvaccinated who are getting coronavirus and suffering the consequences of this often challenging and sometimes fatal disease. We returned to the New Yorker, where this reporter talked about some of our physicians here at the University of Utah earlier in the pandemic, particularly when our team and our physicians were in New York City helping to care for New Yorkers in early parts of the pandemic. But they now return, and through the report of one of our doctors, talks about an individual who chose not to become vaccinated and, quote, would just thought he would ride it out, that it would be a 2-week ordeal, and then he'd start to get better. But as Dr. Abereg points out, that's not what happened. Despite ventilation and other life-saving maneuvers, oxygen, blood pressure dropped, and eventually the heart stopped and the individual died. So while individuals think they can just ride out COVID-19, this is a very severe and very devastating disease. The Delta variant is particularly more virulent, as we like to say. It causes more severe disease. In addition, it is more transmissible. So we need to continue to focus on getting as many individuals in our community vaccinated, getting that reproductive number down below 1 so that we can get this virus not increasing, but we can get this virus receding, declining in our community. Thank you in advance for all you're doing to help us in this endeavor. We'll continue to keep an eye on things, and we'll be back in 2 weeks to give you an additional COVID-19 update. Thank you.